Good afternoon, colleagues.
Hello.
Thank you so much for joining today afternoon. I would love us to give it 2 minutes so that we start off. But in the meantime, if you can, within the chat, if you can introduce yourself and where you're joining from. It could be the country, but also your place of work. We are really grateful for joining us today afternoon, and we look forward to a really interactive session. Okay, good afternoon once again. By name's Aloysius Nyombi. I coordinate the East African Agency Social and Gender Norms Learning Collaborative. We are happy that you're joining us today afternoon for this learning session. I've just had a quick look into the chat room, and I could look, I got a sense of so many persons within the social behavior change space, but also persons interested in programming around HIV and AIDS. And today afternoon, we get to hear from our colleague from Rwanda sharing her experience with the implementation of a key population program. And tries to tell us what the implications for programming are, but also the social norms and agency implications. So I really look forward to this conversation today afternoon. Before I call in the presenter, I would love to introduce you, for those that are joining us for the first time, I want to introduce you to the Eastern Africa Agency Social and Gender Norms Learning Collaborative, just in brief, and then we shall get into our discussion. The East African Learning Collaborative is part of a big global collaborative called Social Norms and Agency Learning Collaborative. So we are part of the 5 communities, one in South Asia, the other in West Africa. Within West Africa, we have 2 learning communities, the Francophone and the Anglophone. And also we have what we call the Global Social Norms and Agency Learning Collaborative, that brings together researchers, practitioners that don't follow under the other learning collaboratives. So together we form the Social Norms and Agency Learning Collaborative. And we are a network of researchers, policymakers, practitioners that collectively advance social norms and agency theory, research, and practice. And for the East African Learning Collaborative, we have a particular interest in issues around gender and gender norms. So if you look at today's discussion around key populations, and with a specific focus on women, so you could see that this is a topic of interest to us as a learning collaborative. So what do? We document and share experiences. We improve practice through partnerships. So we have both organization and individual membership. And thus we encourage, but also we forge different partnerships to see that we improve social behavior change. We also co-create social norms, resources, and products. For example, the social norms exploration tool, and that can be accessed at no cost. My colleagues will be putting a link within the chat where you can access these particular resources around social norm practice, but also social norm measurement. But also we strengthen capacity. Sometimes we have trainings, physical and online, where we train in areas around agency, social and gender norms. Specifically on the East African Agency Social and Gender Norms Learning Collaborative, so we cover 7 countries, that's Uganda, Kenya, Tanzania, Rwanda, Burundi, South Sudan, DRC, and Ethiopia. And currently, since early this year, we are working in partnership with the Agency for All project, which is also a global project with a number of stakeholders, I think about close to more than 10 stakeholders. And our partnership with the Agency for All is really... Brand. Okay, sorry about that. So I was saying that we work in partnership with the Agency for All project, and the Agency for All project presents a lot of research results, which we utilize within the Learning Collaborative. For today's webinar is going to be presented by Jocelyn Emery. Jocelyn Emily is from Rwanda. She's a section productive health and rights activist. She has over 7 years of diverse experience in project management, partner stewardship, resource mobilization, health system strengthening, digital health innovations, and effective communication within the health sector. Emery is a regional public health manager at Swiss Tropical Public Health Institute. It's our presenter today, Emery, that is her brief profile. Quickly through our agenda, so we are done with the welcome from us. Then we shall have the webinar presentation. Then we shall get into the preliminary discussion, and then we shall get feedback and wrap up this particular discussion. Allow me to welcome Emery so that she makes her presentation to us. Emery, you're most welcome.
Yeah, thank you very much. I think you all can hear me. I think, Aloysius, your voice, I think, was a bit lower. I don't know if it's the same for everyone that is following. Am I audible? Is everyone hearing me well?
Yes, I can hear
Yes,
you well.
please.
Okay, that's perfect. Should I share my slides from this side or your side?
I will share on this side. Hopefully you can see my screen well.
Yeah, I can see it. So thank you very much for this opportunity. I would like to appreciate this opportunity to present to this knowledgeable platform. It's not always easy. However much you can get comfortable, I can say get easier. So it's always like a mixture of like anxiety, but also, yeah, I think excitement and anxiety, but I really think I will make it happen. So before I start, I think you introduced me well. Besides being the regional manager for Swiss Tropical Public Health Institute, I do a lot of research, but also I'm a pharmacist by background. So we take you through the legal implication, but also like a health implication through this like a specific topic. So I think maybe can you make it bigger, the screen? I think I can see with my eyes here. I think you can maybe make it bigger. I think I lost the other side.
Aloysius, can we have one screen? From what we are seeing two screens. I don't know if everyone is seeing that.
Yes.
Yeah, the screen is too small.
Now we are seeing Josie's face.
Okay. Maybe while he's figuring out the screen and the presentation, I can maybe like highlight the topic we are going to discuss is a very contentious or contested. Okay, my English is starting to be misbehaved, but yeah, it's very like like it has like a different opinions around it, and I wish that we like we are scientists, we should maybe like back up our argument with like clear like arguments. If it's a no, it can be like no because of, and yes because of this. Yeah, I think it's very like controversial, but also like something we shouldn't hide in the cupboard, because these are lives of our sisters, our cousins, of like our like neighbors. So I think, yeah, I would like to give that context so that yeah, we are on a same page. Yeah, so I think maybe, I don't know if I can share from my side. Should I wait maybe? Okay. Okay, if you make it full screen.
Makerri.
So just checking in, Jocelyn, is that visible enough?
It's still
No.
small.
Yeah, maybe Jocelyn can share from her side and we see.
Yeah, let me share from my side. I think this will be like easier. I think I have the slides.
Okay.
From, yeah, this will be, I think, great from my side. Wait, yeah. Okay. Let me download this. And share it. Okay. Let me share. Share. Can you see? I think the screen is bigger now. Can the audience see now?
It's not on full view. Put it on full view.
Like
yes.
this?
Yes, that's
Yeah, we can see, but not on field view.
Yes.
But increase
Joseph,
the size. Increase the size of it's full view, but increase the size of the slide, I think.
I think
Yeah.
this is how it's presented because it's in full mode.
Okay. But you can
Yeah,
go
But that's
ahead.
still okay.
I can talk through the slides. the importance is like missing the, like the, what the key lines, but we talk through the slides. I think everyone will be able to hear me well. So starting by the outline, we are going to talk about the global HIV burden. We will see women and girls versus HIV globally and at the sub-Saharan level, East African regions. But we also like go to the Rwandan level with like a Rwanda HIV burden. We will see the Rwandan legal framework. We will see social gender norms and the agency implication of sex work in Rwanda. We see some of like the efforts around decriminalization of sex work in Rwanda in 2018, but also we introduce a bit on the key population program, results, challenges, maybe like get your reflection on the presentation. I think this is a topic that really takes, it can even like take 3 days with discussions, and I'm trying to wrap up this into like 40 minutes. I will try my best to like to give you the key lines and an overview of how this is going on. So starting by the global HIV burden, since the start of the epidemic, this was back in 19th, where like people got like the first case of like infection was detected. We have since then 88.4 million people who have become infected with HIV. So within this, with this being said, 42.3 million have died from AIDS-related illnesses. Like HIV doesn't cure, but the AIDS-related illnesses, those are the ones that kill. So the new infections have been reduced by 60%. When I say new infection, this means an infection that dates into like 1 year. So since the peak of HIV, this is back in 95, new infections have been reduced to 60%. And 39.9 million people were globally living with HIV in 2023. So although 30.7 million were accessing antiretroviral therapy in 2023, 630 people died from AIDS-related illnesses in 2023. These were facts from UNAIDS fact sheet. So when we go into like this, the gender disaggregate, women and girls versus HIV burden, globally, all the 44% of all new HIV infections were among women and girls. This is in 2023, which means out of like 1.3 million, women and girls were 572,000 women and girls that had like a new infection. And of all this, women and girls in the sub-Saharan region accounted for 62%. I know like how we are all Uganda, Kenya, we are into the sub-Saharan region. So we had 62% of like new infection. So when we try to like to simplify it for everyone to understand, every week, 4,000 adolescent girls and young women aged in their age range of like 15 to 24 years became infected globally in 2023. And among the 4,000, 3,100 occurred in sub-Saharan Africa in our countries. Yeah. So when we go in Rwanda, so Rwanda has tried its best to make progress in reducing HIV prevalence among the general population. When I say general population, it's everyone in the country. And we have stabilized it at 3% for the last decade. We've done this through accelerated scale-up for HIV testing, immediate linkage to antiretroviral treatment. Maybe to give a bit of context, in Rwanda, we used to give ARVs for someone who had maybe, to simplify this, less than 500 copies per milliliter, 500 copies of virus per milliliter. This means that like someone has gone bad, you're closer to death. That's when we used to like to initiate ARVs. But with like this treat-up strategy, once you are detected with HIV, you get on ARVs. Another thing that Rwanda has done quite well was condom availability, but also like being able to trace index for people who are HIV infected, but also we've done quite well in terms of scaling up prevention of mother-to-child transmission intervention. Another key factor was around voluntary medical male circumcision. Research or facts say that once one is circumcised, can have a chance of preventing HIV to 60%. So this is a high percentage, but again, it's recommended to use both circumcision, but also using a condom. So despite this progress, the HIV prevalence rates among key populations, which maybe I will give you a bit of context while I'm moving. So key populations, these are people that are at a high risk of acquiring HIV, which include the female sex workers, and this specific group will be like a target for today. So they have a prevalence of 45.8%. This was in the DHS, or Demographic Health Survey in Rwanda, 2015. So when we analyze, we found that this figure is 15 times higher than the HIV prevalence in the general population, which is at 3%. This shows the vulnerability for this specific group of people. So it's estimated that female sex workers contribute up to 46% of new infections in Rwanda. So all new infection that happens in Rwanda, 46% comes from this specific group of people. So when we go into the Rwandan legal framework, we are a secular state that has a constitution. So we have a constitution that guarantees every Rwandan the right to life. This is in Article 12 of the Constitution. Right to dignity in Article 13. Non-discrimination, this is Article 16. Equality before the law, this is Article 15. Protection from discrimination and the right to privacy in Article 23. Right to freedom of movement in Article 26. Bodily integrity and autonomy, liberty and security of person, among other key rights in the Rwandan Constitution. However, when we go back in the Rwandan Penal Code of 2012, Rwanda used to criminalize sex work, and this was disproportionately affecting girls and women. So for instance, if we take the Article 205 of the Penal Code of Rwanda, it used to stipulate that any person who engages in prostitution would fulfill a period not exceeding 1 year in prison. Once you're caught as a sex worker, you were taken to jail. And other implications were included that any sex worker that was identified should not leave territorial limits determined by the court, not to go to certain places determined by the court. The court would say you are not allowed to go here. And they were subjected to surveillance measures, including periodically reporting to administrative services or authorities determined by the court. So violation of these obligations were determined by the court, and it could result into an imprisonment of 3 to 6 months. So the implication is that although the Constitution of Rwanda, which was revised again, maybe I will take you through the new penal code, the Constitution, it was revised into, our Constitution was revised into 2015, emphasized the country's commitment to rule of law, respect for human rights, and equality for all, including gender equality. Not only this, maybe to give you a bit of a background, we have the Rwandan Constitution, but we have subscribed to international legal framework, including the Maputo Protocol, the CEDAW, that guarantees women the rights, the equal rights for women. So with this being said, criminalization of sex work, it really increased women's vulnerability and to rights violation. So some of the implication of the rights violation of the Article 205 of the Penal Code included breach of a right to dignity for sex workers. It was breaching the right to equal protection and non-discrimination. It was also breaching the right to equal protection because, for instance, punishment was applied to female sex workers without court conviction, whereas the partner that will, like someone can be engaged in sexual activities, but sometimes they are engaged with like someone else. They would like protect a partner to a sex worker, but punish a sex worker. It was unfair. But also it was this Article 205 of the Penal Code was violating the right to bodily integrity, but also the right to liberty and security of female sex workers. Just jumped. Okay. So social and gender norms, agency implication for this was the stigma. First of all, it was stigma. Female sex workers faced a significant stigma due to religious beliefs. Even if like we are a secular, even if we are a secular country, it doesn't remove the freedom to religion. So female sex workers were facing religious stigma due to religious belief and the societal expectations of how women should behave. Thus, this has affected their access to healthcare services, and this was increasing their vulnerability to HIV. Also, another implication was criminalization. Sex work for women was illegal, and this has led to illegal detention, surveillances, but also like other rights violations, inequality. So female sex workers were disproportionately treated unequally compared to their male counterparts. Once they're engaged in a sexual activity, they were punished alone rather than be punishing the male counterparts. Another key aspect was sexual violence. Female sex workers were exposed to violence and exploitation. For instance, maybe I will give that case study once we get into like the implementation of key population program, where like the reality or the lived reality of lived experience of like sex workers in Rwanda. So another thing was reduced autonomy and agency. Criminalization and stigma really limited female sex workers' ability to make safe, informed decisions regarding their health due to restricted legal frameworks. Another thing was somehow barriers that prevented female sex workers from achieving empowerment, because once you have like a hostile environment for like a certain group of population, it's really hard to achieve a certain level of empowerment. So this being said, a group of like different people sat together and started the advocacy. And I would like to take you through the youth strategies to decriminalize sex work in Rwanda. So this was actually like in response to the global efforts and UN agencies' recommendation. As I said, Rwanda has subscribed to the international regional legal framework. So we were recommended to decriminalize sex work and promote anti-discriminatory laws that protect sex workers' access to social, health, and financial services, because not only sex workers were affected at the health level, but also you would find like a kid of sex worker not even like being registered. Once they know she's a kid of a sex worker, they would be denied access to education indirectly, because once you're not registered, you can't attend school. Yeah, so some of the strategies that Rwanda implemented to decriminalize sex worker under its 2012 Penal Code, these strategies really aim to align with the international human rights standard while ensuring the protection and right of sex workers. So the strategies included formation of coalition between civil society and CBOs to raise awareness on the negative impact of criminalization of sex worker. And also, I know like sometimes when we do this kind of like work of advocacy, we say this is unfair, this is unacceptable. But once you share like sex workers' vulnerability to HIV, abuse, exploitation, and other human rights implication, you really like touch the heart of like policymakers. Another strategy included leveraging international and regional legal framework to lobby at platforms such as, for instance, we lobbied at the African Union Summit, urging Rwanda to comply with human rights agreement. We also like lobbied parliament. This was like a coalition of civil society, and lobbied some key champions in the parliament that would advocate for this specific cause. And also we used another channel, which was like a submitting policy brief to the Rwandan Law Reform Commission and Parliament advocating for decriminalization for sex worker. So maybe to give you a context on this, most of like the parliamentarians we have in Rwanda, they don't have a background in law. Sometimes they don't understand, like the implication of like maybe constitution and the penal code. So civil society really simplify the language for them to understand the implication. Once you simplify through a policy brief, some people get to understand the implication, or the parliamentarian or other decision makers. Another thing was advocacy meetings with government institutions and other CSOs to highlight how Article 205 hindered HIV reduction effort among sex workers. Another thing was around, value clarification and attitude transformation. Sessions with healthcare providers to clarify values. Most of the time, healthcare as we have, we had and we have in Rwanda, we tend to confuse two things, ethical obligations with like your moral values. So what we did was more of the government of Rwanda decriminalized sex work in Rwanda in 2018. So despite this reform, I can't say that we are there yet, but what has this, the implication or the outcome of this decriminalization, they have protected sex workers, and in the current penal code, they no longer criminalize sex workers, but this is again a point for discussion. They criminalize partners because they are in position of buying rather than like being in position being bought, So the Rwandan penal code now criminalize or punish a buyer rather than like someone who is being bought. Yeah, so it's again like a point for like a discussion, but this like was an approach that was benchmarked from Sweden, and he has quite worked. As key population. As I said, they have a high prevalence of HIV, 45.8 of HIV prevalence. So they were recognized, but also prioritized into the National Strategic Plan on HIV. It was 2013 to 2018, but now it has extended to this year, 2024. So they have like a specific intervention targeting these specific groups. So I know like how we go through the pros and cons of decriminalization, legalization, criminalization, decriminalization, and the legalization. I've tried to touch base on some pros and cons of criminalization, because there is no like I can't say that there is like the best approach of like making it work, but we choose depending on a context, but also on what are the outcomes of a given methodology that you chose. So maybe like taking you through the decriminalization pros and cons. Decriminalization really removes criminality for selling sex to sex work. The pros were that they reduce stigma and discrimination. It really like enhance safety and access to justice of sex workers without fearing arrest or legal repercussions. It really improves health outcomes, but also it really aligns with human rights, because again, we have to align with human rights. The cons is that it really like enforce continued informal nature of sex work, because if they are not like really regulated into labor rights, they can end up, being not like really that protected, or typically provided to other or like limited to other like if it's like benefits related to other professions. But also another key aspect of decriminalization is that the con is that lack of structure for trafficking detection. So you might find that once one is engaged into to consensual sex work, but you can't actually like differentiate who is being like trafficked for this like a specific sex work. For the legalization, the prongs, we go through them like quickly. Structured protections, access to benefit and rights, stronger trafficking controls, public health oversight. For the cons, we will have like restrictive regulations. I will give you a case study for Senegal that has, I think they have the legalized sex work in 1969, and what have been achieved so far. So there is also like potential invasion of privacy, but also sometimes there is exclusion of marginalized workers. So as I said, the case study for Senegal, Senegal has legalized sex work in 1969 under strict government regulations, which really aim to both public health and social control. The laws required that because it's still ongoing, that a sex worker register with health and government authorities, obtain a health card, and participate in a regular health checkups, typically monthly, to screen for STIs, including HIV. They have to work within approved zones or specific areas and follow local regulations, and they have to be at least 21 years old to register legally as a sex worker. So the implication, there is health protection with autonomy trade-offs. So legalization really centered on public health, improved safety, but it really infringed on bodily autonomy through mandatory health checks. You know, like if you're registered into like this program, you're obliged to go in a given like period of time. You don't really have like a choice. So there is also like limited agency through strict regulation. While legalized status protected against criminal penalties, rigid regulation like mandatory registration limited sex workers' autonomy, leaving unregistered workers a bit like vulnerable. But also another implication that I really like highlighted was partial stigma reduction. So legalization offered some legitimacy, but deep-rooted social stigma persisted, especially for unregistered workers, pointing to the need for public education alongside with legal recognition. So now, going back to the key population program in Rwanda, the government of Rwanda had recognized sex workers into like national strategic plan, for like intensified interventions around this specific group of people. So the Ministry of Health mandated civil society organization to implement targeted intervention across the country to bridge the gap in HIV services and promote female sex workers' health rights to health. The intervention included capacity building of sex workers on their rights, example, right to health, right to bodily autonomy. It also like included advocacy meeting and capacity building sessions of key stakeholders, which included healthcare providers to uphold the right of female sex workers. It also really included linkage and referral to services. This included preventive and care treatment, including HIV testing, ARVs pickup, condom pickup, and antenatal care. Another activity or intervention was an awareness campaign on the community on the right of sex workers, because we can do everything, but once the community doesn't really like have this tolerance around this specific group of people, we end up not like achieving the anticipated results. So impact of the key population program implementation. So the implementation I mentioned, they started as a piloting phase. It started in 6 districts, but as we saw, some of the results or the positive outcomes was scaled up into like other districts. It was really like basing on the data that the country had in specific like regions. So we would like go into a given region, but guided by the survey or like the data from the government level. So I can say one of like the biggest outcomes was that there was an improved health outcome of sex workers with a decline of 15.5 decline of HIV prevalence in less than a decade. As I mentioned, from the DHS of 2010, this was when sex work was decriminalized. The prevalence was 51%. Currently, we don't really have, I think the next DHS will be published in 2025, but we have another report, official report from the Ministry of Health that shows that the HIV prevalence for sex workers has gone to 35.5. And it has really contributed to reduce violence and exploitation, reduce stigma and discrimination, and also it has improved agency and bodily autonomy and tolerance of sex workers at the community level. So some of the challenges we have, even if we have done or made this like progress in terms of like decriminalizing sex work, we still have discriminatory and stigmatizing practices. Even if like, healthcare providers have been trained, the community has been sensitized, we still have these like persistent discriminatory and stigmatizing practices. When basically like sex workers are accessing basic services, including access to health care services, but also like those specific like specific needs for every Rwandan. So another key aspect is that even if like they were decriminalized, they still report illegal detention and physical and sexual violence by the police or clients. I can give an example. In one of the districts we're working in, during COVID, this is like in the southern province of Rwanda, during COVID-19, you remember that we had restricted movements, So some of the sex workers were detained among people who breathe. James, can you mute? Okay. Yeah. So one of the sex workers were reported among people who, who didn't really like abide to the movement restrictions. And one thing that happened, the police liberated freed the other like people and remained with a sex worker. This sex worker was raped and was treated unequally to the remaining population. So he was raped because he was afraid if he doesn't have sex with this like specific police, he would end up being in jail. So he ended up having an unconsensual sex. Yeah, so this is another implication. Another maybe case study I can give in the same district. This is in the north. In the southern province, where some of like in the government we have like a high turnover. We have like some people coming in, some people leaving. So the people that have been trained sometimes leave. So there was like this. I won't mention the name. There was this specific like government authority that authorized that they should go and take everyone, because they know where they live, take everyone who is like a sex worker into their detention centers. So there were 300 that were detained. Detained, and they managed like to call some of the lawyers that were working with us, and we had to like to do an advocacy so these like people would be liberated. And maybe closing, another thing would be like lack of economic opportunities that still exposes many female sex workers to precarious and unsafe working conditions. So again, when I'm talking about these female sex workers, I'm not talking about like these VIPs, because these have how like they operate. But with this vulnerable population, and most of the time we had a study whereby we wanted to know what are like the factors that led one into sex work, and realized that most of them, they were impregnated when they were kids. When they were teens. If like we were impregnated and you were 15 and were chased from your home, and you had to feed that kid, some enters into sex work. So it's a double vulnerability. So wrapping up my presentation, my question is decriminalization, legalization, criminalization, what's the solution? Thank you very much for your attention.
Thank you so much, Emery, for that insightful presentation. Quite a number of things that I've noted here, the issue of how criminalization, stigma intersects with agency. That was really interesting to me. The question of how social and legal norms intersect, yeah, and then increases the vulnerability of sex workers. That was also an interesting question to me, and you explain it well, how legal and social norms intersect to then strengthen the vulnerability of sex workers in Rwanda. But also from a programming point of view, how speaking about the life experiences of the sex workers works in issues of advocacy. I thought that was strong on my end. Yeah. Colleagues, it's time now for you to ask if you have any comments, if you have any questions. It's time for us to pose those questions. If you want to seek clarity from Emery on particular issues, the time is now. You can post that in the chat, or you could raise your hand and then ask that question, make that comment, or make that addition. Over to you, colleagues.
Aloysius, there's a question in the chat box by Mensa. Mensa, are you able to ask your question?
As Mensa comes in, there is a comment from Daphne, and she says, at times, I think the secretive nature of sex work protects them, because when they come into the public, the visibility at times end up hurting them. Emily, what do you think about that?
Yeah,
Quite
I
an
saw
interesting
the question,
perspective.
and I think like some people has responded to this. Yeah, the question for Mansal Ahmad, right? The question from Mansal Ahmad. I think some people like has actually like responded, like Josephat Karaoke, saying that
Mansour Al-Mahdi.
Sorry?
Mansour Al-Mahdi.
Oh, okay. Mansour Mahdi. Al-Hamadi, okay. Sorry for misspelling your name. Yeah, so I think they are not paying taxes, and they are not having IDs. I think this is like is it like a name that UNAIDS has put into place once they have identified them as key populations. So I think it's a universal name, and I think someone, Josephat, has answered some of like the concerns. Yeah, I think it's a name that has been given by UNAIDS, and as I said, we subscribe to the international, like a legal framework, but also like we do some work with like international organizations. Yeah. Another question is, are women
I'm not
sex
clear
workers?
till now. I'm not clear
Sorry.
till now. I'm not clear till now. Because today they are, if they are a sex worker, who named them? Who named them first? Secondly, are they paying the tax for the government? Are they paying tax? Unless you can change a terms.
Yeah, thank you very much.
They should have their ID, who indicate themselves as their serving as sexual workers.
Okay, thank you very much, Manso. As I mentioned, this is a name that was given by UNAIDS, and this is like an agency that is overseeing HIV reduction across the globe. And they don't have IDs, and they don't pay taxes. As I mentioned, there is a difference between legalization and criminalization. Legalization, in the case of Senegal, that's when they have IDs, and there are some other implications, including the health checkups every month. So that's not the context in Rwanda. I think there is someone, Polycarp, that I can respond to if it's a question or like an addition to what I said.
Yes, Polycarp, go ahead.
Thank you so much for that presentation. So I have a question in regards to that. So when you talk about the key population, I meant to understand it's not only the sex workers. We also have men having sex with men and also
Yes.
male sex workers. So I'm very curious to find out from your end in Rwanda, were you also able to, to come across the male sex workers, especially the trans women, the transgendered sex workers, and then looking at the cultural norms within Rwanda, because I know sex work is the oldest profession ever. So looking at it, even the culture, looking at, how they are perceived, the people's perception and attitudes, do you think they are more like accepting the female sex workers as compared to male sex workers? Because where I'm coming from, the male sex workers are very active, they are proactive, and they're coming out strongly and saying, we are also there, we are also sex workers. So I'm curious to find out in Rwanda, do you think there's an issue where the social and cultural norms, they are still having those issues with the male sex workers as compared to the female sex workers? Thank you, and over to you.
Yeah. So, thank you so much, Polycarp, for your interesting question. I think I just oriented this presentation on the topic social and gender norms and affecting women. But among key populations we have in Rwanda, we have sex workers, we have men having sex with other men, we have transgenders in general, we have people who inject drugs. Those are the key populations in Rwanda. But for this specific topic, I chose sex workers because this was like the focus. And around the question you asked about if the tolerance is towards male sex workers and female sex workers within the culture and social norms in Rwanda, I think it's surprising that they tend to accept more or to tolerate female sex workers than men, because even for male sex workers, they have a specific name in Rwanda, in Kinyarwanda, I don't know, I will try to translate it, abapubuzi, which means that you're trying to improve someone's sexuality, if I might put it that way. But I think to respond to that question, people tend to tolerate female sex workers than male sex workers. The same thing, I think this is a contested issue in Uganda for LGBT. They tolerate lesbians and they tolerate gay people. Yeah, so I think maybe I have answered you.
Thank you so much.
Thank you. Thank you. There's other comments that I want to read. There's a question actually from Dr. Simon. He's asking, are women sex workers aware of using a condom as a step of reducing infection?
Yeah, thank you very much.
Can I read out a few other comments?
It's okay. Yeah.
There is a comment here. Maybe it's an addition to the discussion. Sex workers are not subjected to be part of a certain population, but amongst us, they're categorized as a key population, not as an ethnic group.
It's not an ethnic group, either here.
Yeah, like MSM are part of a key population, which are not part of a population, but at risk of vulnerability.
Yeah.
Joseph, do you want to speak to that? But I think I've read it well. It brings out the message you wanted to put forth. Unless if Joseph wants to speak to that. If not, kindly go ahead, Jocelyn, to address.
So, I will start with Chianda, Simon. Yeah, so as I mentioned, some of the interventions that how sex workers we build capacity. I mean, we had capacity building sessions with sex workers, and they were taught to use condom as one of the ways of reducing HIV, but also one of the interventions were around telling them to stick to few partners to reduce the risk of HIV. Yeah, for the Joseph question, I think I've highlighted on that it's not an ethnic group either in Rwanda. It's like one of like the group of key population. As I mentioned, we have MSM, we have transgenders, we have people who inject drugs, and sex workers. You've been able to how have you been able to strike a balance between criminalization and desired behaviors such as condom use? I think maybe you mean decriminalization, because criminalization wasn't even like promoting condom use and enrollment to ARVs. Because once a sex worker would voluntarily report, the health center would be actually detained because the law were criminalizing them. They couldn't even access the basic rights to health. So I think decriminalization effort has actually like led to promotion of desired behaviors such as condom use, but also enrollment for ARVs. Another question. Okay, is there any other question?
Yes, colleagues, any other question? You could raise your hand and pose the question or comment. Yeah. Let me see. Yeah, there was a comment that I read out earlier, though I think we had missed out on it. At times, I think the secretive nature of sex work protects them. How do you respond to that?
Sorry, I didn't get you well.
It's from Daphne Agaba. At times, I think the secretive nature of sex work protects them because when they come into the public, the visibility at times end up hurting them. What's your view about that?
Yeah, the secretive nature, I think it's still like secretive because, okay, it's like, again, like a very like hard question to answer, to be honest. Yeah, I think that can be like contested because, again, being secretive, which means not them being not like recognized, it would end up into like it's a hard question. Let me reflect on that. And we come back to that once you have like another question. But I think it's contested.
No, maybe if I could clarify, if I could clarify on my question. And I think actually it's a hard one to think about and contemplate. I know from what you're saying, Rwanda has just decriminalized, but you've not yet gone beyond decriminalization to legalization. Am I getting that right?
True, decriminalization.
Yes. So that is the first step. You've not gone ahead. So I was thinking about the case study you gave us. Which country was that of the case study you gave us where
Senegal.
Give us an example of what you said. You said there's some measures they put in place as a result of legalization. So I was thinking that sometimes when you actually take that, I'm trying to find responses to the decriminalization versus legalization argument. So when you legalize, you put in place measures to ensure the safety. So some of the measures I think about in my mind are safe spaces for these people, checkups, the national IDs that someone was talking about. And in my mind, I was thinking that sometimes couldn't that lead to actually endangering the life of the female sex workers, because we still live in a climate, we've not talked about it a lot, but we still live in a climate that is deeply moral, deeply religious, deeply, so those kinds of perceptions about the work they do themselves. I think that is a perspective that I was thinking about. Yes.
Thank you. Yeah, thank you very much, Daphne. That's actually one of the arguments that Rwanda had, because once you have like 200,000 sex workers that have ID, and you know like the location, and you know where they can go easily for like a health checkup, and monthly it's like an obligation. I think it's really like not really like, I mean, it can lead to some like like bad intentions once you have like all the database at with you. That's why I think Rwanda didn't really like take a further step into legalization, because at least someone is protected by the law, but again, is not like obliged to report to like, it would again like be similar to what we really like had in the penal code, where they had to like to report to the authorities or to the government officials. So I think, yeah, that's why like Rwanda, I mean, we have like a state to this like a level of like decriminalization, having them like having equal rights with like the other like a counterpart Rwandans. So I think your point is really like valid. The secretive nature would protect them rather than like putting them in the public. Yeah, so thank you very much for your contribution.
Okay, let me see if there are any additional. Okay, I don't see any additional comments within the chat. Colleagues?
I think I think Chris Pass wrote, how have you been able to strike a balance between criminalization and promotion of desired behavior such as condom use, enrolling for ART? I don't know if your earlier response.
I have responded that.
Was,
yeah, I have responded to that. Yeah.
Yeah, thank you.
Okay, colleagues, it seems like if there are no any other questions or comments, this has been a really interesting conversation, particular insights that I've never thought about. Yeah, it helps me to understand the issue of sex work, elements of criminalization, decriminalization, yeah, and elements of the lived experiences of these of sex workers. Yeah, really, really important. There are a few things as we conclude. There are a few things that I want to draw you at. We have an upcoming annual conference, December 4th to 5th. It's both physical and online. My colleagues will paste within the chat a link to that. Kindly register, kindly submit an abstract. Jocelyn, I'll be so happy to see if you submit an abstract on this so that we have another conversation around the same. It's really, really interesting.
Okay, that would be great.
My colleagues will also share a link for those that are not part of the collaborative yet. Kindly join us to have such conversations. There's much more that we offer beyond just webinars. We develop resources. We develop books. Yeah, we document positive norms. We document issues around agency, social norms. So come join us, be part of the family, let's learn together. So my colleagues, just check within the chat, those links will be within. So someone is asking for the slides, definitely yes, we are going to share those slides, but also the video recording with you colleagues. Colleagues, allow me to thank, for those that can clap, kindly let us clap and appreciate Jocelyn for this really insightful webinar. So many things to think about. Thanks Polycarp and others that are clapping. So many things to think about. And please, Jocelyn, continue sharing this information. There's a lot to learn from your presentation.
Yeah,
thank you so much for joining us today afternoon. Please be on the lookout. We shall share the presentation, but also share the video recording and let the conversation continue. If there are additional questions or comments on the presentation, you can send it to us. Our email is within the chat, but also the couple of, since you have registered, there are a couple of messages that you have gotten. So it is easy to reach out to us. Yeah. We look forward to other conversations like this, and kindly let's continue the conversation on other platforms. Thank you so much, Emery, and thank you so much, colleagues, for joining us today afternoon. Yeah. Have a good day, and please register for the.
Thank you so much. Bye.
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 Bye.